guys, it's me, and I have a kind of personal health update. For all of you that watch my channel, you're aware I'm a type 1 diabetic. I have been since I've been 7, so over 25 years. And with diabetes, it comes with a lot of hard work and a lot of struggle. Type 1 diabetes is just one of those diseases that unfortunately has no cure, and the treatment I have to treat myself with is insulin injections and just scientific math. But being diabetic, that means everything in my body is affected by this disease. What I have not covered on this channel regarding type 1 diabetes or diabetes in general is oral care and dental health. Now, I have had many rodeos with the dentist, none of them really quite so bad as it has been this year. I have periodontal disease, which means I had a gum infection in my gums, which was there, and it made like pockets under the gums and around the teeth, you know, hung out there, and it affected my jawbone and the bone in my jaw. I have a significant amount of bone loss in my lower jaw, and this was caught, and I have had a scaling and root planning and some last minute emergency surgery, so I've had a lot of work done to my bottom jaw with my teeth so far, a lot of cleaning, a lot of maintenance. But because of being diabetic for over 25 years, the bone loss, the dentist said, is actually quite normal for a diabetic who has had it as long as I have. Now, this complication also comes into hand with not having great control over your blood sugar. Now, I'm not saying that I haven't had great control over my blood sugar, but anytime you're, high or low, or, over the years, it can take a toll on your body. And unfortunately, getting gum disease and bone loss in your head is a complication which you could experience. Now, I'm not saying everyone gets this. I mean, some people just have really amazing health orally, but what makes it so concerning is that with healing and diabetes, that's always an issue, but your mouth is pretty dirty. I mean, you eat, you chew, things get under your gums. I don't know anyone who goes out and about and brushes their teeth after they eat at lunch at work. I mean, I'm sure there are people, but I don't. But being a diabetic, I have to step up my oral hygiene. So that means the day before my birthday, on December 1st, I am going to have a surgery on my mouth. I am going to have a bone graft put into my jaw on my right side. What the dentist is going to do is cut the gums away from my teeth that are there and pack it with cadaver bone material, put it in around the tooth, under the tooth, whatever, sew it up, and I leave. I don't get put under for this. I'm going to be localized, and I am completely nervous about this because, just the thought of someone cutting your gums away from your teeth and packing it with material, stitching you up, is terrifying. I know it's a normal procedure. I'm sure people who are watching this have seen it or have done that procedure and thought it was nothing. But what you guys also don't know is I have a really bad dental anxiety. I haven't had any bad issues with the dentist. I've had your normal issues with the dentist. Maybe it didn't go as well as you wanted it to, but I have a fear or something about the dentist office because I guess I am diabetic, and I do know how important oral care is, and that I'm always worried that something bad is going to happen at the dentist office, and it kind of did. This did. So going to the dentist in general for regular checkups is terrifying. You know, I get very nervous, I get nauseous. I mean, I can tell you there have been many times I avoided going to the dentist, which is not good. Because of this anxiety, I have canceled appointments, I have rescheduled, you know, it's not, I don't advise it, but the anxiety and the fear of going is real. You know, it's really hard for me to go, but I've been over 6 times in a month to the dentist, and I can't avoid it. I can't cancel, I can't reschedule. If I do, I'm going to lose my teeth, and I don't want that. So this is very important, and it's really hard for me to go through with this surgery because it is the day before my birthday. I'm going to be on a liquid, soft food diet, and it's not going to be fun. And I have to be very careful because there's a good chance that the bone graft won't take. So, you know, being diabetic, we have to take every precaution we can to ensure that things go fine. So I just wanted to update you guys on that, that I'm going to be going through this amazing surgery, but I wanted to address oral hygiene and how it can be a complication of diabetes, and for someone who has had it this long, having this much bone loss is actually quite normal. So there's that. Comment down below, do you guys have a fear of the dentist as well? Not that I want to share horror stories about the dentist, because I personally don't want to see any of that, but I mean, just know that there are other people out there that share the same fears I do, or you do. But I hope you guys are, you know, doing better than me and not having these kinds of issues with your teeth. Anyhow, I thank you guys so very much for watching. There's going to be links down below about diabetes of videos that I have done if you want to learn more about type 1 diabetes. And until next time, take care.